where I wanted to introduce you to our guest that we have, a very special guest. Dr. Laquita Morris is in the building. She is the assistant professor of family medicine and community health at the University of Massachusetts and has a special practice and still practice as a full family doctor in helping with delivering babies. Uh, it's a pleasure to have you today.
Thank you. Thanks for having me. I appreciate it.
Okay. All right. So the heart of today, or the music that we're really trying to get out into the world, is really equipping and preparing young doctors as they're entering into this space. What are some opportunities or mistakes that they can avoid? You're also a professor, so you're teaching other young doctors, right, in your field and study of work. So you get to see this all the time and you've lived this.
Mhm.
So we want to hop straight into it with the first question.
Okay.
So let's say you are starting medical school. Name one mistake you made and one way others can avoid it.
Absolutely. Thinking about this question, I'll narrow it down because there were a lot of mistakes that I made, but, I
Okay.
would say one of the biggest mistakes that I made would be accepting the full loan amount that they offer you to
Yeah.
borrow instead of really sitting down, doing a budget, determining how much you actually need, and then accepting that amount. I think I was still in, like, that humble beginnings, like, mindset in terms of just take it all and, if you need it, it's there. If you don't need it, you can give it back. But I would really, really recommend that you just sit down and work with somebody if you don't have that background.
Mhm.
Um, Figure out what your school expenses are gonna be, what additional funding you need for your living expenses, and only take out what you need because they'll offer you large lump sums and you only may need half of it. So that's one mistake I think I made.
Yeah. I think, yeah, I would double click on that. I think that's a lot of mistake that a lot of us make
Mhm,
if we don't, let's say we're the first person in our family, to go on to be a doctor.
mhm,
Nobody really knows about the products that are out there, right?
absolutely.
And is it okay to say no to this? Right? Like I just
Mhm,
know somebody's throwing a whole lot of money at me, and they saying I can have it here pretty soon.
exactly,
And I think I know I'm gonna make some money when I get done, so I should be able to pay it, so,
exactly. That's the
yeah.
mindset, but you wanna kinda change the way that you think about those things, for sure.
So go ahead, you said you got a couple other ones. What's another one if you had to throw a bonus one?
Um, I would say, I guess along the same lines, try to cut costs wherever you can. So if you
Mm.
can live with somebody, a family member, a mentor throughout medical school, as long as that environment is conducive to you learning, right? If you
Yeah,
can live with somebody and kind of cut costs that way, I would highly recommend it. If you can work prior to medical school and save that money that you're getting prior to medical school, it just makes a big difference in the end. So you don't wake up at the end of medical school, you're doing that exit counseling and you're like, wait, how much did I borrow? So it can be a big wake up call at the end. So just try to cut costs as much as you can.
yeah, that's awesome. And I know these weren't on we didn't send these, but if you had to do it all over again, who are the people that you'd reach out to maybe help consult before taking out those loans? Is there a
Mm,
program? Is there, I could say some
yeah.
names, but what comes off the top of your
Yeah.
head?
So now looking back, obviously with 2020 vision, I would say if I could either afford or find a financial advisor or a financial counselor that could help me out going into it, I would definitely do that. If I could find a Derrick Alexander before medical school, I would definitely do that. But I had no idea that these things existed. Like I said, I come from very humble beginnings. It's
Yeah,
pretty much like you do what you need to do to survive. We don't even get the chance to think about financial wellness or money management. It's like you get what you need to put a roof over your head and to be able to eat, right? So
right.
I had no idea. But now knowing that these resources exist, I would highly recommend it to anybody.
Yeah, yeah. And I'd add alongside that, you got some programs out there as well. You got like, institutions like Graphene, right? Or what is it? White Coast, what is it? What is that website? White Coat
Um,
Investor,
yeah,
like
like
those are
what
good sources. Like if you're already looking at going into the field, go ahead and start looking at that information. And
absolutely.
or if there's a doctor in your area, right,
Mhm,
that you hit it off with, or you're in the midst of um, going into that field at that
mhm,
university, let's go tag along with a doctor and just like pick their brains, and just say,
exactly.
hey, show me. This is what I'm thinking about doing.
Mhm,
How do I go about this appropriately? Right. Let me get in touch
exactly.
with a Dr. Laquita Mortis, like let me get on her program. Right. You're gonna have to need to start a podcast or a web page. People gonna start reaching out
Something.
to you.
Something. Yeah, I'm definitely open to that. As many people as I can help, I'm open to it because it makes a big difference. So, absolutely.
Yeah. Okay. Question number 2. You're starting residency.
Okay.
What's a mistake you see a lot of young doctors make financially? And what would be a recommendation for them based on your story?
All right. So starting residency, one of the biggest mistakes that I see for residents is they go from not having a salary at all to having not a lot, but a little
Right.
bit of money. They're no longer paying out to get their education. They're actually receiving an income. And for me, it was a big difference in the amount of income. So I would recommend continue to live modestly, right? So you're in medical school, you're cutting costs where you can, you're living a certain lifestyle. You're comfortable, but you want to live in a way that will allow you to be successful in the future. And I think that's something that I did, and I would highly recommend that to other people. That allowed me to start saving. So I started saving, not much, but a little bit in residency. And at that time, my income was low enough to still qualify for the Roth IRA.
Yeah.
And so I was able to put money into like one of those tax sensitive accounts, which is something that I would recommend as well. And I would do everything necessary to in my mind, I was trying to do everything necessary to keep me from being poor again. So
Yeah.
if that meant like, all right, I'm gonna start saving now so that I don't have to worry about it later, then that was a little bit of the compromise and the sacrifice that I took. And again, just working with somebody that has the knowledge that you want to gain financially when it comes to financial wellness and management. So just starting out creating those healthy habits right out of medical school, it'll just set you up for those things being second nature in the future.
Man.
Mhm.
Preach. Yeah. It's
And
it's that foundational part is so important, right?
mhm,
Because when you first start making some money, it's not about not going back to being poor. Sometimes it's about not feeling poor.
yep, absolutely.
So it's like I
Absolutely,
need
yeah.
to go get this car. I'm gonna go get my house. Maybe not a house on the residency, but I'm just saying, like, you know, your quality of life might raise from where you were just trying to get by. And now you're like,
Mhm,
man, I don't want to feel like that.
mhm, absolutely. You said it right, like, not feeling poor is the
Mhm.
thing, and man, it makes it makes a big difference. Another thing that I did was sign up for the, public service loan forgiveness in residency. Now, I don't know what that's gonna look like in the future,
Yeah,
but
yeah,
I did sign up for that in residency, like, very early in residency, and again, income wasn't high enough for me to even have to make payments, so it was zero per month, but those still count towards the PSLF payment, so something
yeah.
else to look into.
That's so good. That's so good.
Mhm,
And then also speaking about you started saving early, right? Like that right there, if you can start saving at the beginning of starting to create your income, because that's
mhm.
the only way we're ever going to get to the point where you won't go back to feeling right or right. It's like
Yeah.
you said that, instead of spending to not feel it, when you
Mhm.
save it over time, you get to a point 5, 10 years later, you start looking at your account. You're like, even if I walked away from this job, right?
Yeah,
Like I'm okay, So,
exactly.
yeah. And then the
Mhm.
evolution of like creating income outside of it, right? Like
Mhm.
all those things start becoming opportunities and available.
Mhm.
becoming available to you because you have those assets there.
And you start to look, like you said, look at those accounts like, "I've never seen this much money before in my life. This is kinda cool." You
Yeah,
know? It was worth it.
yeah, yeah, that's great. Okay, so question number 3.
Mhm.
So now you're practicing.
Mhm.
What's the best piece of advice you could give to a young physician? Maybe
Okay.
professionally, maybe like working with the office, maybe office dynamics.
Okay.
And then I think we talked on some financially, but if you can elaborate a little bit more on, now
Yeah.
you got the benefits and things, but
Mhm.
what are the best piece of advice you give to a young physician?
Yeah. I would say professionally, you'll have a lot of options coming out of residency, especially in my field of family medicine. They're always looking for family medicine doctors
Mhm.
because of the wide scope of practice that we provide, especially if you practice obstetrics with family medicine. Places are always looking for those doctors. So you will have your choice of where you want to go. Shop around, see what places are like, go and visit, see what the dynamics are like in the office among the staff and the providers, and determine where you feel at home. Like, if you're at a place visiting and you feel like, yeah, I can actually talk to these people, they get me, I get them, we laugh at each other's jokes,
Yeah.
it just feels comfortable here, you can be yourself. I would say, especially as a doctor of color, make sure you feel comfortable where you're going to be working because you're going to spend a lot of time with these people in some pretty heavy situations often too. So making sure that you just feel at home wherever you decide to work, I would say that would be one of my biggest pieces of advice.
I really like what you said at the end there because you're going to be in some pretty heavy situations, right? So you don't want to
Mhm.
be in an environment, especially when you have all the options where you feel like you can't come in and be yourself.
Exactly. Hmm.
Right. And yeah, yeah. I think that is so, and that kind of speaks to the culture, right? The
Hmm.
culture of the environment that you're going into.
Right. Right. Absolutely. So yeah, it's important to make sure you have that support when needed.
What clicked for you when you were coming out of residency from the
Hmm.
past from the places that you attended that made
Hmm.
you feel like you were at home? Like, what was there anything that stood out, or was there a moment that you were like, you know what, I think this is good?
Okay. That's a great question. I won't say names here, but
Yeah.
this is my second job out of residency. So when I compare the two, I would say what made me feel at home now versus before is representation. At
Okay.
my prior job, I was the only Black person on faculty out
Mm,
of 70 in a department, which can be very isolating at times. It can feel like you're riding solo.
yep.
And again, you shouldn't have to feel like that in your workplace.
Hmm.
So now, outside of even just like the faculty, the staff, the residents, it's so much diversity that there's no way that I could feel like I'm by myself. There's no way that I could feel like I don't have that support if I'm going through something, especially if it's race related,
Yeah.
that I have more than one person I can go and talk to about it and feel supported. And they understand. I also, when I interviewed for this place, like I said, I just felt every person that I spoke with, we had a connection, and that's rare for an interview day. Every single person that I spoke with, we actually ran over time because we got to talking about something that we were both
Oh,
interested in,
yeah.
and that hasn't happened to me before, and it's held true. Like, they were all being themselves during the interview day. I can still relate to those people on a personal level to this day, so I think that's what made the difference for me.
Yeah, I think that's great to put out there. So if you're a CEO uh, of a hospital, right, and you're staffing, like this is good information because it's
Mhm.
it's not necessarily on purpose, right? Like, you know, okay, well, yes, yeah. So, maybe I think maybe for the majority, right? For the majority, I don't think it's on purpose. I think it's more about the awareness, right? The awareness of as you're going to have more doctors of color coming out of these residencies and these programs, that it is important to have representation. Just
Mhm.
because being able to empathize culturally on a background can mean a lot,
Right.
right, in certain situations, especially in situations of pressure. So that means a lot. I think that's really
Mm.
important. So if you're somebody out there that's in, hiring doctors, let's, mix it up a little bit.
It matters. It matters for sure. For sure. Yes.
Okay. Well, so in closing, okay,
Mhm,
the floor is open. If there was anything that I should have asked that maybe I didn't get to,
mhm,
is there any piece, or let's call this open heart, right? Like, is there
mhm.
anything on your heart that you'd like to share?
Um, I would say, we talked a lot today about, sacrificing and saving and compromising. I'm not saying that people should not have fun. You
There you
have
go.
worked hard to get to this point. You deserve to have fun. You deserve to live your life. And you can still do that. You can take a trip. You can buy yourself something nice. You can whatever that thing is for you, you can do that while also setting yourself up for success in the future when it comes to money management. So that's my piece. Like, don't, deprive yourself, but
Yeah.
also do it responsibly.
Hey, because you definitely take trips.
Oh, I take my
I
trips.
just
I'm gonna take my trips.
those
But I
trips
do
never
it.
went anywhere. Like they just got included into the budget. Like
There
I'm
you
gonna
go.
take these
You
trips.
just include it in there. You do your saving. Maybe skip out on the Starbucks for a few weeks, get your trip money. But yeah, I'm gonna take my trips for sure. So
That's good. I love that. That is good. Yeah. Well, thank you for today. Thank you for being a trailblazer, like going through, starting on this path, being representation and being willing to speak on it on camera.
absolutely.
So just want to say thank you for your time today.